When we are little, we learn the basics of interacting with others. This skill is one we practiced during our playdates, even before we start our schooling. This is also the time we begin to develop our first goals, regardless of how realistic they are. And then we grow up and follow these dreams, or at least try to pursue a version. But in an attempt to do so, we become mechanic and often forget the basic interaction we learned as a child. This commonly occurs in the medical field, in the sense that during a long day of work, a patient's version of what otherwise may be a very common case can be seen as just another number. As a result, patients are easily categorized and labeled by their diagnosis, rather than their names and stories. Medicine is a field known for prioritizing evidence-based performance. This can cause healthcare professionals to unintentionally distance themselves from their patients by avoiding emotions in order to focus on biomedical facts. When patients are put into boxes, labeled as a disease rather than their name, we risk dehumanization. A journal entry published in the U.S. National Library of Health states it best. Individually, doctors and nurses have a duty to show compassion. An absence can lead to patients feeling devalued and can show a lack of emotional support. In fact, it has been shown that physician empathy can potentially help patients heal faster. As we can see, doctor-to-patient connection is very important. By opening the restraints of the box and getting to know the patients on a personal level rather than as a diagnosis, doctors are able to instill hope in the patients. So let's all show some more compassion to our fellow human beings rather than placing them into boxes.